Hi guys, Zoe here. Today's video is about the most common signs and symptoms that indicate you might have one of the 3 most common hormonal imbalances that I come across in my practice when I'm working with clients one-to-one. So the first one is PMS, otherwise known as premenstrual syndrome. Now, a lot of women consider the signs and symptoms of PMS to be completely normal and part of being a woman. But in fact, if you have very extreme cramping pain around your period, or really severe mood swings, weeping, crying, raging, to the extent that they affect your closest relationships negatively, if you have extreme water retention or cravings for foods, those symptoms are actually not normal. They indicate that you may well have, or you probably do have, a hormonal imbalance. And one of these hormonal imbalances could be an excess of estrogen, and that's actually really common these days. The good news is there's a lot that can be done with dietary change and natural supplements and herbs, and that's actually something I work with frequently. And I'll be making other videos in future on some of the ways you can actually tackle this, and in some cases completely eradicate these horrible PMS symptoms altogether by balancing your hormones. The second thing is if you have signs of PCOS. Now, PCOS, otherwise known as polycystic ovarian syndrome, is actually really common these days, and it's a condition that involves having many cysts on your ovaries. And obviously you might have absolutely no idea that you have cysts on your ovaries, and the only way to actually ascertain whether you do is to go to your healthcare provider and have a scan. But if you are having some of these signs and symptoms, it's definitely worthwhile going to have one of those scans, because you could well have PCOS. The signs and symptoms of PCOS involve suddenly having acne on your face. For example, if you haven't had spots since you were a teenager and all of a sudden you've got acne, particularly acne around your jawline, your mouth, on your chest or upper back, they're typical signs of PCOS type of acne. If you suddenly have male pattern hair growth, so you suddenly start growing hair on your face where you never had it before, that's a sign. If you also suddenly gain weight, that can be very common in women with PCOS, and having a lot of cravings, really extreme cravings for sugar. Now, some of the reasons these signs and symptoms actually appear is because some of the hormone imbalances that underpin PCOS are an excess of estrogen and a very unbalanced blood sugar level, and a condition called insulin resistance. And when those two things come together, they tend to generate the symptoms I've just outlined. But again, PCOS is something that responds really well to dietary intervention and natural supplementation. The third condition, the third hormonal imbalance that is so common these days is hypothyroidism, which basically means a low functioning or under functioning thyroid gland. Now, the reason that this is important is because the thyroid gland, which sits about here, sets our metabolic rate. So when it's under functioning, the signs and symptoms of that involve having a very low body temperature all of a sudden. Suddenly you're feeling the cold really easily. You suddenly gain a lot of weight. You lose hair on the top of your head. You suddenly feel really depressed or have foggy thinking. They're the most common signs and symptoms of hypothyroidism. But again, hypothyroidism needs to be actually diagnosed or confirmed via your healthcare provider through a series of blood tests. And if you get a positive diagnosis alongside, having those symptoms, then you may have to go on pharmaceutical medication. However, if you have a condition called subclinical hyperthyroidism, which means you haven't developed full-blown hypothyroidism yet, you can actually work at improving the health of your thyroid gland through changing your diet and taking natural supplements. And even if you do actually have full-blown hypothyroidism, actually, it still responds well to a dietary change. And you can do dietary change alongside pharmaceutical medicine as well, if that's your choice, and if that's what you need to do for your health. Anyway, it's a huge subject, hormonal imbalances, and I just wanted to touch on the 3 most common hormonal imbalances that I come across in clinical practice. There's a lot more that I deal with and come across regularly, and I'm going to be talking about those in future videos. So have a wonderful day. Thank you for watching, and I'll see you next time.